she's an old lady. And the first 10 patients that we have done in telecardiology were over 75 years old, and we were not expecting to have receptivity from the population of this age. And what she's saying, that she felt more comfortable in this consultation than face-to-face. She has more time to ask her question. In face-to-face, the doctor is always rushing, and she almost forgets the question that she wants to ask. And we have also testimony for other people over 75 years old who were very, very pleased and satisfied with the teleconsultation. So I want just to finish on saying we are different, but we are also same in this. We're facing the same challenges, we have the same issues, and I agree with all my colleagues that we can share a lot and we can maximize our expertise to advance and give more quality of services to the patients. Thank you very much.
So it gives me great pleasure to introduce our next speaker. I've been told by the organizers we'll try to keep our comments to the 12-minute period if possible. So we'll try to do that just to maintain time. Dr. Muthukrishnan Rajaranan is from the City University in London, UK, and will be speaking on privacy and security in telemedicine. He's been actively researching this topic, has published significantly, and has edited a book together with Cisco entitled The Healthcare Revolution. It's a fairly large seller from the European Alliance for Innovation book series. He's also published Mobile Security and Privacy and XML-based mobile services for healthcare management. He's part of Cisco's think tank for health IT, and I welcome him to address us. Thank you.
Thank you, Chairman. Let me first thank the organizers, and I have only 10 minutes, so I may not go through all the slides, but it's a privilege to actually work with Dr. Ganapathy on one of our recent funded projects, which is worth 3 million UK pounds, to map the telemedicine in the UK with India, so which is match funding with DST. And my special thanks also goes to Dr. Ramasamy for actually funding this project, as it has been put as one of the landmark projects, as you have seen this morning. It is one thing that India would love to actually see on the ground. But coming from a security and privacy background, I'd like to give you some of the challenges that we face once we go in full-scale implementation of telemedicine across India. I just come back from the UT Chandigarh administration. They are trying to go through their e-governance policies, and one of the challenges we face is, as my colleagues here just mentioned, if my kids are not well or if I am suddenly collapsed on this stage, at the moment the UK health services will not be able to release any data to the Indian health services. So there are major challenges across the globe because of the different policies that are defined across by the different governments in this space. So I'll just give you quickly some of the flavors of the importance of security and privacy in healthcare. As we see that several speakers have mentioned about getting medication through your apps, warning messages through text messages. But if you have seen, just in India, I just read this morning that the government has just lifted the ban of 3 text messages for multimedia messages and something like 15 for text messages. If that kind of regulations come in in times of social network movements, then how do we actually safeguard the patient's continuity of patient care? So it's a major challenge. We just need to look at the risk and safety, security and privacy of the patient data. So as we know, the data is highly confidential of each of us. How do we develop systems? I'd just like to throw this to the audience who are IT providers, where you give the control to the patients rather than to you IT providers. Tomorrow, as a patient, I like to see the control of my healthcare data is on my hands. We all speak about 900 million mobile phones that's powering the Indian communication. But how do we actually give the patients the power to actually control the way they actually give the data away, to give the delegation of their data to the other healthcare providers and to the insurance providers and to any other doctors or medical practitioners? So these are some of the standards for privacy that exist. I just don't want to go through. There are well-established US standards. But if you see for India, the IT Act 2000 still doesn't pay a lot of attention to privacy, which, as when I debate this in government meetings, it's always been said, in Indian culture, a father or a mother can actually open the child's post. So it actually gives them the power to actually see what the child is receiving from somewhere else. But you see the difference that the first speaker this afternoon spoke about superhighway or fiber optics connecting the urban and rural divide. But if you are going to give that kind of telemonitoring internationally, then you need to cross borders, you need to have some policies which are internationally adapted so that you can cross borders and use the expertise available internationally. So there are some common principles in the existing frameworks that are actually followed internationally. You need to be open and transparent. Patient must be able to control the privacy of personal health information, and the data should be kept well closed and safeguarded so that no one else can actually tamper with the data. These are very sensitive data. It could be from any citizen of the country. Identity theft, we have seen recently. We again been awarded a major project, a UK-India project, on trying to identify and establish the identity of individuals using your email IDs, including myself. I have 5 Facebook accounts and 3 LinkedIn accounts. So how do you actually establish my identity when I try to actually have a Facebook account with a different name, with a personality who is very famous? A Twitter account. People might start following me on a healthcare Twitter, for example, in a case of a disaster. How do you actually authenticate the identity of these email IDs and the Twitter tags? Access threats, I'll quickly go over these. I'm not going to waste time on these. Disclosure threat. So just as some of these primitives that the IT needs to think is the identity threat, access threat, and the disclosure threat. So we need to give importance to authentication. Anonymity, we want to anonymize our data. I want to protect when I try to get some information regarding, for example, cancer. I don't want the whole community to know that I have actually been a victim of a specific type of cancer. There are different techniques that's been available internationally. There are role-based access control techniques. There are technologies for data integrity. There are technologies for secure transmission. So these are some of the final summary points. As Dr. Ganapathy mentioned, food for thought for the community to take away. We see an explosive growth of the mobile phones. We see several mobile apps that's been given, from managing your nutrition to having healthy eating. And as you know, recently, Apple has been actually trying to harvest data from our mobile phones to actually pass it to marketing companies. How do we protect this? How do we identify these are genuine or fake apps that are coming on the Android and the iPhone market? As I mentioned earlier, patients should be able to have full control over their data. We are moving to a cloud. Again have a new project that's been just sanctioned called Bridging the Urban-Rural Divide for India in Healthcare Delivery using Cloud Computing. Major challenge. We all want to go over the cloud. The governments are thinking about having a G-Cloud where all the government services, including the healthcare service, can be delivered over the cloud. But as you know, including all the CIOs of healthcare companies will resist back saying that we just don't know. Security is our major concern. So moving on, we have these several challenges. And as an India is a country, we tried to just start this project with doing a mapping study with the 50 million population in the United Kingdom to a 1.2 billion in India. It's not a joke. It's a serious problem. But together with Dr. Ganapathy, All India Institute of Medicine, Indian Institute of Management, Ahmedabad, and several of my colleagues from Newcastle University, Aberdeen University, IBM UK, and IBM India, together with both the governments, we are determined to at least achieve 10% of our objectives to serve the mankind through mobiles. Thank you.
Here is Dr. Sumant Raman, Head of Healthcare Innovation for TCS. He'll be speaking on intelligent clinical systems. Dr. Sumant has been active in the field of healthcare IT for more than 15 years, been involved in numerous implementations across the IT domains